moving to the next topic, we're going to be talking about long-term care facilities and updates, and updating one executive order related to that. And today's announcement we're making is related to visitation at long-term care facilities, which includes all three levels: skilled nursing, which is something that people know about all over the country; basic care, which is something unique to North Dakota, which is paid for by the state of North Dakota; and assisted living. And as you recall, one of the things we did early on in this crisis, which we know has helped save lives, has been to suspend visitation to long-term care facilities. We did that on April 6th. On April 21st, we released our North Dakota, our ND SMART VP3, the Vulnerable Population Protection Plan, to ensure that hospitals, long-term care facilities, intermediate care, other congregate facilities had the resources to prepare and handle COVID-19. And that VP3 plan also covered other places where we had vulnerable populations, including homeless shelters, developmentally disability group homes, and domestic violence shelters. This afternoon, I signed an executive order modifying restrictions on our visitation to long-term care facilities, which again will allow them to resume in a phased approach based on the factors outlined in the VP3 plan. We shared on last Friday, Chris Jones did, that we were heading in this direction, and this formalizes that again in this modification, because in that executive order back on April 6th, we had suspended visitation. This modification allows us to begin that phased reopening plan. One thing I do want to make sure that everybody understands that we're also announcing today, and we've taken a look at what other states have considered doing, some that have just started doing. We want to be on the front end because we are all about reuniting people with their loved ones. We know the stress and strain of isolation is real. We know that it's got an effect on behavioral health. We know that connection with loved ones is one of the things that helps improve health. And so Chris Jones, myself, and the entire team here are completely and totally committed to making sure that we can reconnect people with their loved ones. But we're also totally committed to protecting all those individuals in congregate care, because as I walk through the numbers, you can see when we've got 74% of the deaths that we've had in the entire state have occurred in long-term care facilities. We want to make sure that we're protecting those individuals in those facilities who've got many years left to live. We want to make sure that that they and the workers that work there are all safe. So one thing that we're announcing today, and this is that we're strongly supporting the commencement of outdoor visitation with some caveats. So and this will be up to the facility management, but if facility management can provide clean masks, appropriate social distancing, do it by appointment, and provide a safe location. And by safe location, we'd like to mean some outdoor location that's, say, not the parking lot, or not a place where safe both in terms of physical, but also safe in terms of potential spread of contagion. Then as soon as the facilities have these plans for outdoor visitation, that can occur. And so again, please work with if you're a family member, give the long-term care community a little bit of time, because they're hearing about this perhaps right now for the first time. Give them a little bit of time, and then call them and see when you can make an appointment. And again, do that in a way where, again, you're respecting that social distancing, the masks, and staying outdoors as you get reconnected with your loved ones. And again, it's not just to protect your loved ones, but to all of their fellow residents in that facility. Of course, if you've got any reason to believe that you are sick or not feeling well, please wait or go. If you're sick, go get tested. But please wait until you're in a better shape, or again, get tested to make sure that you're negative before you begin visitation to see your loved ones. The VP3 plan phase process for indoor visitation looks at a couple of different factors, and this was shared in part on Friday, but we'll explain a little bit more now. And this is where we are going to look at the context of where the facility is located by county, as well as the prevalence in the county and the prevalence of active COVID residences. So there are two gating factors. The first is the amount of active COVID cases in the county, and we have a number of counties that have had such low prevalence that this gate has already been cleared. There are other examples, such as the prevalence in Cass County, where there is not an opportunity yet to be open for visitation and long-term care. But as I just said, even in Cass County, we would strongly encourage outdoor visitation. Again, if you can keep separate, wear a mask, have a safe physical location, make an appointment, that you're going to be able to do that while we're waiting for the indoor visitation. The second gating factor, if the first gating factor is the county, the second gating factor is whether or not there are active residents in the facilities. And as long as there are no new active residents, the facility can move to the next phase. In the first phase, which is again pre-visitation right now, if you've got a facility that's got a no active residents and no active staff right now, and you're in a county that's got low prevalence, then you can start reinstitute things like communal dining and bingo and some of the important internal socialization that we know goes on in our long-term care facilities. And after you've cleared the first phase, after 14 days and another round of testing and no new positive residents, facilities can open to the inside visitation. Over 40 facilities have already had their phase 1 plan approved, which means in 14 days, they're on track within 14 days that they may be able to proceed with indoor visitation, assuming that during this period they have no new active positives with residents. If you've got an active positive with a staff member, we can remove those individuals and isolate them outside the facility. So the gating relates to active residents. We also, again, would encourage anybody who's thinking about visiting. Again, there's lots of opportunities in our state to get tested. We've got tens of thousands of kits. We've got additional capacity at the lab, and so again, we would encourage people that are thinking about visitation to consider getting tested. We are leading the nation in opening up our economy, and we are being on the aggressive side of trying to open up our long-term care, because we're trying to balance the importance of the mental health and the connection with family with the physical risks. We know how important that interaction with loved ones is on both the physical and the mental health. But of course, doing all of this would not be possible without the great testing data that we've accumulated, because we've done substantial testing around the state, and we're going to continue to evaluate how we can increase visitation. But to do that, we also have to think about how we're potentially increasing testing as well. We are kicking around some ideas about doing some pilots about testing all visitors that might come to long-term care for the indoor visits in the weeks ahead. If we've got the capacity to do that, that would be another way to make sure we're really protecting our residents. Today